If you've been watching my channel, you've seen some of the short videos with one of my patients who's using a setup just like you see here behind me. Now, all this is a standard chair with a smooth surface board. This is actually a shelf out of one of the cabinets, but it's got such a smooth surface that I can put it at an angle on the chair. Now, the reason why we use something like this is because my particular patient doesn't have the hip mobility to be able to sit in one chair and put his foot up on another chair of equal height. So having a board like this allows me to keep the hip in a more comfortable position while placing his foot in a position that allows gravity to help with the knee extension. I use a pillowcase or a towel under the heel to reduce friction. I'll show you what I'm talking about. So all this is a standard. I can pick this up at any Home Depot or Lowe's. I place it on the front edge of the chair. My client will take a seat. They'll have something that reduces friction on the surface. They'll place their heel on the board. Now, if I sit back too far, there's still going to be a bend in the knee. That's not going to achieve the goal that we're looking for. So what I try to have my clients do is I have them sit forward enough so that they're almost sitting on the board. The leg can go into near full extension or get as much extension as they have available. If I pull this up, you can see there's usually a little gapping here. And then in this position, we can perform heel slides. You're familiar with heel slides, but the difference between doing them here versus doing them on a table or a bed or sitting on the floor is gravity is actually assisting to pull my foot down, and that traction force helps to improve knee extension. And that's ultimately the goal of something like this. And we might spend 5 or 6 minutes in this position. Every minute, I might encourage a round of 5 to 10 heel slides just to activate the musculature. And then the rest of that 1 minute round will be spent with total relaxation, allowing gravity to do the work to pull the knee down into extension. This is one of my favorite ways for somebody who has spinal or hip issues and just can't comfortably sit in a chair with their foot at the same level as their hip and their knee in full extension.